welcome to Case News, channel 4763. I'm Emily.
And I'm Sharon. Breaking news. Joan Rivers didn't make it last night. So tragic.
Fashion Police will never be the same.
We have Sharon live at Mount Sinai Hospital in New York to tell us more about what happened.
We are with Joan Rivers live, and it looks like it's about time to say goodbye. Doctors were trying to wean Joan off of the ventilator, and an adverse effect was her blood pressure and heart rate was just dropping. So we administered Levophed, did all kinds of things, and nothing was seeming to help her, so we had to let her go.
That's so tragic, Sharon. But tell me, what is Levophed?
That's a great question, Emily. Levophed is actually known as norepinephrine, and it's a vasoconstrictor. It's used for patients in a hypotensive state or going through heart failure. Its onset is actually only 1 to 2 minutes, and its duration is only 1 to 2 minutes. So initially, we administer 2 to 3 mLs via IV, and for maintenance, we administer 0.5 or to 1 ml. However often we need to after the initial. We also assess that it's working because the patient's heart rate and blood pressure immediately starts to increase.
Wow, Sharon, sounds to me like that's a alpha-beta adrenergic agonist that functions as a peripheral vasoconstrictor and stimulates the heart.
Wait, what?
You didn't take pharmacology at Newscasters 101?
No, I took it at SJVC.
Oh.
But what are some side effects, Sharon?
Side effects for Levophed is pain, itching, or swelling, chest pain, and muscle pain or weakness.
Such a tragedy to lose Joan Rivers. It's going to be a great loss in the entertainment world.
Next up, what local teens are getting into?
Do you wake up and notice you are swollen and fuller looking throughout the day? Has your doctor told you you have congestive heart failure, chronic kidney disease, or high blood pressure? If you have noticed swelling of your body and your doctor has diagnosed you with one or all of these conditions, contact your doctor today and ask him about Lasix. Lasix is also known as furosemide. It's a potent diuretic or water pill that is used to eliminate water and salt from the body. In the kidneys, salt, which is composed of sodium and chloride, water and other small molecules normally are filtered out of the blood and into the tubules of the kidney. The filtered fluid ultimately becomes urine. Most of the sodium chloride and water that is filtered out of the blood is reabsorbed into the blood before the filtered fluid becomes urine and is eliminated from the body. Furosemide works by blocking the absorption of sodium chloride and water from the filtered fluid in the kidney tubules, causing a profound increase of output of urine. Lasix is sold in pill and liquid form. The usual starting oral dose for treatment of edema in adults is 20 to 80 milligrams as a single dose. The same dose or an increased dose may be administered 6 to 8 hours later. Doses may be increased 20 to 40 milligrams every 6 to 8 hours until the desired effect occurs. The effective dose may be administered once or twice daily. Some patients may require 600 milligrams. If you're treating hypertension, the recommended dose is 40 milligrams twice a day. The dose of other blood pressure medications should be reduced by half when furosemide is added. Some common side effects of Lasix include low blood pressure, dehydration, electrolyte depletion, for example, low sodium and potassium. Less common side effects include jaundice, ringing of the ears, sensitivity to light, rash, pancreatitis, nausea, diarrhea, abdominal pain, and dizziness. Increased blood sugar and uric acid levels may also occur. It is severely cautioned for people that don't have a bladder. But don't take our word for it, we're just trying to sell you another pill. Here's a testimonial from another satisfied customer, Mr. Naidar.
All right.
Mr. Naidar, hi there. So you've taken Lasix before?
Yeah, I have.
And what did your doctor prescribe it for?
I was having some issues breathing. They were saying that too much water in my lungs. And I think doctor put me on like 800 milligrams. I don't know if it's normal or not. But he put me on 800 milligrams of Lasix one time. And I went to the bathroom. Stayed there for a few hours and came back with a changed man. Not only was my lung ailment gone away, but also ended up losing about 100 pounds.
Oh, wow.
So LASIK worked for me.
Maybe I should try it. We have another testimonial for an osmotic diuretic called mannitol. And how did mannitol help you?
Mannitol decreased my intracranial pressure. Thanks, Mannitol. Welcome back to Case News, channel 204. That was a really informative commercial.
That was great. I think I'm gonna ask my doctor.
So should you. In other news, big scandal with the local teens. Kids have been buying dopamine thinking it's dope. Here's more from Dr. Takalata. We are here today with Dr. Takalata to discuss dopamine, the drugs local teens are mistaking as dope. Now tell me, Dr. Takalata, what is dopamine and what does it do?
Dopamine is a catecholamine. It's a vasopressor. And what it does is it treats people who have heart failure or heart attack, kidney failure, low blood pressure, or they're recovering from surgery. And what it does is it's actually a beta-2, acts on the beta-2 receptors to increase cardiac output. And then it acts on the alpha-1 receptors, and that is to increase the systemic vascular flow.
That is very interesting. Now, these local teens are experiencing some side effects. Can you tell me what they are?
Really, the main side effect of dopamine is tachycardia. It's when the heart beats faster than 90 beats per minute.
Can you tell me what the normal dosages are for this drug?
The normal dosage for dopamine is 5 to 20 milligrams per kilograms per minute.
Wow, that's probably different from dope.
It is quite different than dope. So kids, don't do dope.
Or dopamine. Wow, Dr. Takalata, is dopamine a lot like delbutamine?
That's a good question. Actually, it is very similar. However, dopamine actually metabolizes into norepinephrine, so it has the same effects as norepinephrine does once it's used in the body. Dobutamine, however, is not metabolized into norepinephrine. It can still treat heart failure, and it can also help those with low cardiac output. Is there anything you'd like to add, Miss Pharmacology expert?
Well, actually, Dr. Takalata, there are a couple of things I would like to add. Dobutamine is also actually called diuretics, and it's a beta adrenergic agonist. And there's a couple effects you'll see in patients that are using this drug. Their mean arterial pressure, their pulmonary capillary wedge pressure, and their systemic vascular resistance will all go down, and their cardiac output will actually go up. And there's a couple side effects I think are really important about it. It increases your heart rate and your blood pressure.
Well, I'm down here then.
I really enjoyed your commercial about furosemide or LASIK.
No, same thing.
Oh, okay, it's the same thing.
Yeah.
I think I really need to talk to my doctor about if that's right for me. What do you think?
I think so. If you're having problems, yes.
Oh yeah, tons of problems.
Oh.
You don't even understand. I think it's just a result of age. But what do you think about Joan Rivers?
It's so tragic. So
Was she a
tragic.
dear friend?
She was. She actually was only 6'2".
Was she?
She was.
Wow. Furosemide was right for Joan Rivers. It might just be right for you. Can you believe those teenagers?
What are they teaching kids nowadays?
They can't even buy the right drugs. What can you do?
I don't know.
I guess that's just how the cookie crumbles nowadays.
Well, thanks for watching Case News, Channel 52.
Stay classy, SJVC.
Say stay classy at the same time.
Okay.
Yeah.
Okay, we'll both say
Stay
classy.
say you lean in with your left arm, I'll lean in with my right arm.
Oh, okay.
Stay classy, SJVC. What? Are you filming this?